Georgia Institute on Aging. We welcome you to this presentation and looking forward to any questions at the end of the call. We are going to mute all lines. Today we have with us Kian Sinai, and he is the founder and CEO of Independa Incorporated. Really excited today about this opportunity to hear the do's and don'ts of technology purchasing and seeing what is the best fit for your organization as a senior living services provider or a home and community-based service provider. Without further ado, I'd like to turn the reign over to Kian.
Thank you, Jackie. It's great to be with everyone today, and I look forward to the presentation that I'll be sharing with you and our interaction right after the presentation. I am going to be talking a little bit about the framework of the market challenges and opportunities, and only a few minutes on Independa for those of you who may not know us. And of course, the bulk of the presentation is going to be really our perspective and hopefully valuable my perspective on the do's and don'ts on picking technology and really leveraging what's out there to the benefit of your organization as a whole, but certainly financially and operationally as well as your residents. So without further ado, let's talk about the market problem. The challenges that we all face are that the age tech model is broken, in our opinion certainly, and you might be living that experience every day. The reason is there are just too many silos when it comes to engaging a resident or really more generically an individual. There's too many return on investment opportunities, there's too many discussions, there's too many individual siloed solutions. And from your perspective, it becomes challenging to say the least and daunting, if not impossible, to really make many, many investments all to sort of fall under the umbrella of age tech. And the challenge is that we are not really using the market, and the solutions out there therefore are not really optimized in helping us use technology to prevent the next stage of care. And the next stage of care is sort of beautifully aligned between the resident as well as the organization. So if you have someone who is a resident, we all want them to be there as long and safe and comfortably as possible before we go to the next stage and possibly have to even move out. And similarly, on the folks on the home care side, that's an innate desire to stay in the home for as long as possible, which I know Leading Age is recognizing wonderfully, and we as an industry recognize that that's also an opportunity to assist. So the technology is really not being optimized to enable that. What's been missing in action is a powerful social engagement model as well as an organizational engagement model, both of which sort of converge to provide benefits to everyone involved. In other words, the organization as well as, in this case, the residents. And what really is the solution is we need to get to a holistic platform to connect the communities, the senior living communities, as well as the friends and family of the residents to the resident. So think of it as really three different parties involved and benefiting. The organization themselves, the resident themselves, as well as the circle of care around them, the informal circle of care. Of course, the professional circle of care as well, but that's part of the organization. So the right technology to address this problem has to simplify these challenges. And by simplify, we really mean that in a big way. And if you really take the concept of the simplest of technologies to the extreme, you see the hint there, which is, in our opinion, and we're really passionate about this, it has to be in the TV because of all the benefits that really come with the simplistic and easy-to-use notion of changing an appliance into an engagement platform versus the alternatives. So that's the market challenge, as well as the perspective on what it takes to address it, which is simplicity and holisticness. So for all of us, the market and the opportunity is that the right technology is really at the right time and the right place when it comes to the shifts in our, I would say, sick care system, going from sick care essentially to health care. And if you look at the bottom left progression, I know we all appreciate this, but we're going from episodic to continuity of care. We're going from reactive to predictive. We're going from, as I'm sure everybody's heard by now, value-based codes and insurance, as well as going from sickness to wellness. But the two things that are happening that drive all that are that we're really going finally from a concept of a patient to a person in a population. And we're going from the provider location, in other words, either the hospital or, let's say, a doctor's office or clinic, to the residents. And certainly the senior living community industry has a big role to play in this shift and can both ride the wave of this opportunity as well as make a big difference in their residents' lives when it comes to how do I provide the ability to catch little things before they become big things so that someone stays where they are for as long as possible. So that's where technology has to come in, because when we go from patient to person, what we're saying is that there's not another person sitting there with this individual 7/24, whether a nurse or a professional caregiver or a doctor, et cetera, because that would be obviously prohibitively expensive. But at the same time, we can't have no visibility and no interaction. So that's where technology has to take a role in moving the value-based system forward. So my favorite slide is this one, which is the most common sense slide you'll see, and that has to do with the less we pay where we live, the happier we are. And it's not because we pay less, it's because we don't want to go to the next stage of care. And every time we go to the next stage of care, there's an order of magnitude more cost and anguish involved. So the moral of the story here is whether you're in your home or in an independent living community or assisted living, or you go in as part of one and are part of a CCRC, et cetera, your goal is to stay at that stage of care for as long as possible. And that really is another way to define independence, which is the same and synonymous to how do we stay healthy for as long as possible? How do we not go to the next stage of care because the cost and the anguish and complexities are significantly higher at each step forward. And in this case, from the chart, at each step to the left. You go quite a bit more from a cost perspective, and you go quite a bit down from a quality of life perspective. So the so what of this slide is we all want to be where we are for as long as possible. It's not just about elder care. It's really about anything having to do with chronic conditions, or whether it has to do with behavioral health, or whether it has to do with physical disability, et cetera. There's an innate need to stay as long as we can where we are and we're happy. So how is that going to happen? So the future of healthcare is really being driven by the intersection of the consumer, technology, and healthcare as we knew it in the past. And that sweet spot in the middle is really where the organizations on this call can play a key role, because certainly the consumer, i.e. your resident, or if you have either a CCRC at-home model or even affiliations with home care and or home health, it doesn't have to be inside the four walls of the community. It's really the concept that the consumer is being empowered to play a much larger role in their own care, and the healthcare system is finally being incented to actually make more money from a business perspective by keeping you away. And that's a key difference than only a couple years ago, and that's where the direction is going. And that's why the technology that allows that to happen, on the one hand, is wonderful for the resident and wonderful for their quality of life and wonderful for their family, but on the other hand is also helping the businesses involved and the organizations, if they're not businesses. Obviously, in the case of Leading Age, the term organization applies. But certainly from a healthcare system perspective, there is a business incentive now to keep individuals away. So that's sort of the market opportunity backdrop. Now, our vision at Independa is that we can thrive at any age, and we talk about building our systems for ourselves. And there's no us versus anyone else. No one is ever old. And you as our customers are really viewed as our partners, and we look at that as the opportunity to be a key player in delaying or even eliminating the next stage or episode of care when it comes to independent living. And by independent living, I'm using that broadly, not as an IL versus AL, but in terms of preventing and delaying the next stage of care. So this is the only slide that you see with our bottom showing, so independent and the rest of them, I've endeavored to be as generic as possible. So how do we move forward with technology that is usable and simple? We talked about simplicity. So our view is that the technology has to be inside the TV for it to be optimized in how you can engage with someone. So we are looking, and we think that TV is a central piece of really changing the calculus of how to engage residents, whether it's from an organizational standpoint or whether it's the friends and family from the outside. So TV is central. Next is, certainly mobile apps as well as web-based tools should be available to do that, and there's lots of services you can probably read right on the screen, whether it's medication reminders or calendar reminders, health information, and also social engagement, journaling so everyone can keep tabs and leave comments behind for various parties involved with the care and engagement with mom or dad. And finally, life stories, which is a big piece of the social engagement picture, where you can actually save someone's life essentially in audio files and share them with friends and family and for years and for generations to come. So that's a big desire for family members as well as for the individual themselves. It's very important because they're engaged, and also they are contributing and being listened to. So here's the list. And when Jackie and I were talking about this, we had talked about 10. But as it turns out, when I first started putting the list together some time ago, we started getting to 10 pretty quickly. So if we do the count, we ended up at, I think it finally ended up at 11. 2, 4, 6, 8, yep. No, 12. So we're at 12. I added the go for simplicity just for this call. So I'm going to go over a couple of these here, and then others have their own slides. So having an integrated, holistic approach and avoiding the siloed solutions is probably the most important takeaway from today. And the idea is that if you as an organization are investing in technology, you want to have the platform, not just a tactical solution. And you'll see examples of the difference between the two. But just like a person has different needs over different periods of time, the organization themselves may have different requirements across the continuum of care. And to really make investments in individual silos, and an example of a silo could be, for instance, a telemedicine solution versus, let's say, a environmental and activity sensor solution versus a reminder system versus a tool that provides menus, let's say, in the room so people don't forget to eat as much and as there's higher nutrition compliance, or a tool that provides broadcast messaging if there's a hurricane coming, or if the 6 o'clock dinner is being started, or if, Gone with the Wind is starting to play. So there's all these different aspects of where technology can help, and the challenge has been that each one viewed separately creates essentially an anvil behind the decision-making process. Each time you consider a new one, that anvil becomes harder to manage. So that's key. The second one is calculating the benefits to the organization, the resident, and the family. I can't overemphasize that to have just something that's good for the resident or just for their family or just for the organization is not enough, and each party benefiting from the system should have really a compelling ROI. And there's some slides on that. The next two, which I'll spend a little bit of time on right now, are really more cultural and are as important as any other bullet. And it has to do with really the culture of innovation, the culture of leveraging technology, and really culture of having some level of discipline to keep moving forward with the technology decisions. So, as we all would probably agree, our industry isn't necessarily known for our innovative bend and applications of technology in our industry. That's changing as we speak, which is really exciting for everyone involved, and that's why some of you are on the call today, which is terrific. However, so how do we get that? And where do we go with that? So first is to recommend really having a budget for technology, some level of allocation that makes it easier to not have to go create funding or scrap around for funding. Even if it's a small amount, it really adds up to helping the decision making when you want to do something. And the bigger thing, in my opinion, is to really be able to measure benefits when it comes to technology, and also count on things not necessarily all going perfectly, but that's part of the deal. And really choosing your partnerships, that's the next to last bullet in the do's, choosing your partnerships in a way that you have a partner with your effort, not just a vendor. So I think that's critical to both present a platform of partnership as well as expect it, so that as you learn what's important to you and to your residents, that the right partner really accommodates and adjusts and creates the right solution for you. So these few bullets on that front are really much more cultural, but I would recommend that they're just as important as which individual technology you may be considering. To protect against hardware changes and obsolescence is probably the next in line in terms of the most important technology tidbit for today and recommendation for today. And we'll see a slide that depicts this more visually, but for here I'll share that, as we all know, hardware is going to always be faster, cheaper, better. And I'd be very reticent to engage organizations that recommend their own hardware versus others who might have the same type of solutions. So to give you an example, a motion sensor, for instance, is going to be faster, cheaper, better in 6 months or a year. The scale, the same, maybe a personal emergency response system, etc. And the challenge for all of us in the industry is, how do we have a platform that plugs the right elements in, so you have a central management, central reporting, central alerting, and thresholds across different manufacturers and different tools, so that you're never encumbered by sort of the best decision of the day, which quickly becomes old technology over time. So we want to make sure we protect the decision by having a platform instead of an individual solution. We talked about the TV as a strategic platform. I'll spend a little bit of time on that here. The challenge with tablets, and by the way, we had a tablet, we had the world's first Android tablet. We were really excited about it, and we still are from a historical perspective, and won lots of awards with it. The challenge ended up being for us that, and this is a market issue, not specific to us, is that tablets, of course, need to be charged. And if you're charging a tablet, it's probably not in an environment that it's being used. And if you're using it, if it's still being charged, it's probably not a very comfortable thing. And if it's not being charged, it's going to ultimately run out of batteries. So a very practical, battery issue drives a lot of the issues around tablets to begin with. The next thing is that the form factor of the tablet is difficult to really see and enjoy pictures and words and so forth over time. And if you're sitting somewhere, it's not conducive to interaction in a pleasant, comfortable way. Again, back to simplicity over time. And last but not least is that just empirically, if you think about, and now we're going to the home much more than in a community, but even so in a community, if you think about someone who comes in and goes into their residence and shuts the door, when you think about the concept that they may be alone at that moment, but how are they not lonely? How would they engage the world not to be lonely? The TV is a medium where they are probably engaging their favorite shows for the past many years, a certain pattern and habit for the past many years, and that's something that's comfortable and not something new. And leveraging that phenomenon is a very powerful way to provide an engagement window to that individual and changing that platform from an appliance into an engagement bidirectional tool versus something new to learn. And the same applies, of course, in the same way with a computer, sans the battery issues, but the computer you'd have to be, again, somewhere sitting in front of the computer, and the interaction with the keyboard and virus scans and passwords and so forth is very different than the tool that you already know how to use. So that's the coverage on that bullet in terms of the TV versus PCs or tablets. Also very important to leverage a cloud, and we've all heard the term cloud, but the practical benefit that it brings to all of us is that there's no infrastructure to collect or maintain or purchase. So from that standpoint, there's no server room impact, there's no server involved, there's no additional equipment. Everything would be in the cloud from that standpoint. So the cost and complexity really goes way down. And the always-on aspect of the cloud and the always up-to-date aspect of software from the cloud is a big advantage that should be really part of your calculation today. So we talked about the partnership, not the vendors. And at the end of the day, it's really important for all of this to happen is for simplicity. Simplicity for you as the organization, simplicity for the resident, and simplicity for friends and family to be able to engage a resident and, frankly, in many cases, decrease their level of interruptions and calls and where they can now be empowered to do things on their own with their loved one from a distance. A couple of don'ts. Don't be a laggard. So that's easy to say, but let's talk about why. So what does that mean not to be a laggard? Really, let's not be slow, or also let's not be perfect. That's the issue, and that's where I touched on earlier. It's great to have a culture of we're going to try it, and we're going to partner with the right organization, and we're going to start with the learnings as part of the process, and then as we're implementing, we're comfortable that everything is set to go. So that's the key, is that perfection is going to always get in the way of progress when it comes to implementing technology. Second, related to that, is when you look at the benefits of being a leader, the costs are roughly the same, if not less, because the culture is there versus trying one-offs. But the branding benefits and the separation from the pack really becomes an added advantage versus getting to be known that we're doing this because we absolutely positively must do it because everyone else around us has done it. So today the concept is if you go to a community, you're always going to see a pool or you're always going to see a fitness center. And we all know that not everyone's taking laps at that moment or pumping iron. But they are there as a basic minimum, and that's part of the marketing and part of the amenities and part of the culture and brand for the organization. The same, we think, is going to happen with technology, where those who become the leaders in providing the first step and the best steps forward really leverage that as an amenity, and it's the amenity that everyone gets to use when they come into their residence versus the amenity that maybe most people aren't using on a regular basis. As residents outside of their home and going into the fitness center, let's say. So from that standpoint, being a leader really will have much higher payback than being a laggard. Also, don't be tactical. And by that, I mean think about really the strategic roadmap. Think about, let's call it first principles even, that are important to you and your organization. And with that in mind, then you can take the tactical steps. So to give you an example, imagine I was talking with a gentleman, an owner-operator for a very large organization, and his point to me was, we want to guarantee that anyone moving in from day one can connect with their friends and family around the world. That was his first principle. So that's part of the marketing, that's part of the branding, that's part of the culture, and the building hadn't even gone up yet, but that was part of the strategy that he was looking to implement. So, of course, people have different strategies, and it doesn't have to be that one. But when it comes to technology, it's important to have that big strategy, the first principle or two or three, that must be adhered to, and then the technology, sort of how it's done, is a lot easier to slot in versus purchasing the technology just for its own sake. And last but not least on this list is delivering data is not in any way good. In fact, it's just a bad thing, and I would suggest not to do it at all. The data creates additional problems because somebody else has to then be accountable for figuring out what the data is and what to do about it. And that's really never easy, and also people just don't have the time, given busy schedules, to really accommodate that. So what we want to do is you really want to deliver at the end of the day the exceptions that are based on alerts when something isn't quite right. And those exceptions can be set up obviously differently for different people, but that's where you really get the biggest bang for the buck, is not just data and information, but rules-based exceptions, alerts that really are a call to action. To give you an example on that, getting someone's weight every day, if you want to go run a report, that's great, you can do that. Or the daughter can see that. However, what if they haven't stepped on the scale? Well, do you want to know that? Well, you probably don't care if they haven't stepped on their scale if they're not a congestive heart failure, chronic condition person managing that situation. However, if they are, then yeah, absolutely, you want to know if they haven't stepped on that scale. So that becomes an actionable reminder for them. If they still haven't stepped on the scale, then that's really a challenge, because somebody has to get involved, and whether that's something that the staff is normally involved in doing today anyway, that just makes it more efficient and more effective, or if it's something that's maybe in an IL environment and staff is not directly involved, then what you're doing is empowering the friends and family of that individual who are worried about them and trying to get them to do this anyway, to have a tool, thanks to you, that allows them to do this much more effectively and much more efficiently. And in that model, then the daughter might get an alert that says it's 2 days and mom hasn't stepped on the scale. Now, what if they step on the scale and there's a certain weight that's been gained or lost by a certain time frame? You can set all these thresholds, and again, you don't want to just get the weight, you want to get the exception that something's happening too fast or too slow or hasn't happened, etc. And that's really how you end up catching the little things in order to prevent the big bad things from happening. And those big bad things are always expensive and never desired. So digging a little bit deeper into the many dimensions of what it is to be integrated, and there are really many, and to keep it all simple is really the overlaying cherry on top. So integrated between the organization, the resident, the family, and the friends and family of the individual, the circle of care around them. So that's one concept of integrated. Also, we can call integrated all-in-one, holistic, person-centric. My favorite is probably person-centric. And that's in contrast to a couple things. In contrast to patient-centric, because no one wants to be a patient, no one is a patient. And it's also in contrast to data-centric or product-centric. So in other words, the data is around the person, and it goes across multiple different types of hardware or other types of data being generated, but it's always around the person, versus you have to go to one silo for one thing, another silo for another. And the benefits have to be both social and clinical. So there has to be social engagement as well as clinical engagement models. And for those in the business, especially if you've touched on home care, for instance, or geriatric care management, or effectively touched on that maybe through partnerships inside an independent living community, we know that that's a very powerful model to keep people healthy as long as possible. But traditionally, there wasn't a CMS code or insurance code really for that kind of activity in the healthcare system. So there was this big divide between, let's say, home health and home care, or between the services that could be billed for or not billed for and paid privately. But going forward, there's going to be a blend between all that, because at the end of the day, it's very effective to have a holistic social and clinical view of the person. I gave some examples around, let's say, stepping on the scale or what the thresholds might be, et cetera, for an individual with congestive heart failure. What if somebody got out of bed, 8 times in an evening? Wouldn't that be great to know, and who should know that, and what the exception gets to do about that, or the person gets to do about that based on that exception, is now really valuable information. In the past, there was no insurance code for that. So doctors weren't necessarily tracking it. They might have tracked it when you visited the office. Now they want to prevent maybe a really bad urinary tract infection, and that could be prevented by the daughter. You don't need the doctor to do that if they have visibility for that. So it really depends on the nature of the organization. Going on the more practical side also, what if somebody went in the bathroom for 2 hours and didn't come out? Wouldn't that be valuable information? So none of these are set by us, but they could be set by you, but they don't have to be set by you. You can empower family members to have that visibility and do that. So imagine the cost efficiencies and the operational benefits to be able to engage someone from a distance while they are your resident, while they're under your care and facility, but not necessarily engaging your staff in a very high interaction rate up front. So you're basically empowering others, including most importantly the resident, to stay healthy as long as possible. And that really is the next bullet, is to be available across the continuum of care, and whether it's a community and the different levels of communities, different types of communities as we all know, and or into the home. So the person-centric model really supports that. The facility-centric model doesn't, because it becomes too much of a silo for that one side. So to give you an example, what if there was a tool that's really just great for memory care? Well, that's great if you have only a memory care facility, or just that wing of a assisted living facility, let's say. But engagement goes beyond that. What if the same platform can have specific benefits in memory care, very specific benefits, let's say, for short-term rehab, very specific benefits for independent living, and very specific benefits for home care, depending on the needs of the individual, but the organization always benefits and has a strong ROI. So I've already touched on this, but it's really critical to be holistic across various sensors. So when you think about health, activity, environmental, safety, and wellness and fitness sensors and concerns, those should be all abstracted, and no organization should become beholden to any one manufacturer. So imagine being able to leverage a Fitbit on someone's wrist today, but also a Garmin in 6 months, or maybe an Apple Watch in a year. From your standpoint, you want to leave that open so that you're never really stuck with technology that becomes old. And last but not least is the organization, really the enterprise view, the organizational view, as well as the consumer view, is really critical. So the consumer view is all about simplicity, it's all about usability, it's all about fun and engagement, and that's critical, and it has to be built in and integrated that way. But also from an organizational standpoint, it's really important to have a true bona fide enterprise application that has enterprise benefits and enterprise ROI for you as the organization, not just sort of a widget or a gadget that's inside the room that you don't really get to manage properly. So going to the next slide, this gives you a little bit of a specific view when we talk about all-in-one or holistic. What does that mean? It means really the various functions around the individual have to be viewed in a holistic way and managed and made aware of and be able to set thresholds and alerts against when you take it all in one as a platform. Versus if you look at medical, for instance, a medical view of the individual could be a telemedicine application and a number of hardware components to that. So, and that's a whole industry unto itself, big industry, lots of choices, that's great. But what if you also wanted to have an environmental view of the person's activities? Well, that's not telemedicine, that becomes maybe more of a holistic care view with thresholds, not just the telemedicine view. What if there was cognitive tools involved? What if the social engagement aspect is critical, which it is, we all know it is. So how do you provide that as well? So you address the loneliness and isolation and self-neglect, which leads to medication neglect, which leads to recidivism, and how do you manage that? Whether someone's in a home, and unfortunately, even in many cases when they're in a community, how do you do that efficiently so that friends and family can be empowered to assist with that goal? So having a holistic view is critical. So looking at specific technology benefits on the do side across the board from the organization. So let me give some examples rather than just talk to the bullets in further detail. But top-line growth for the organization really comes in during whether it's a remodel or certainly as part of a new construction opportunity, where you might walk someone in and show them the residence, and you've just shown them the pool and the fitness center and the gazebo and the music area and the bingo area, all of that, and the theater. And the comment would be, when you walk in, apart from all the great things, and you just had your 5-star meal as you come in the evening, you may be alone. You will never be lonely, because that thing hanging on the wall is not just a regular TV. It's an engagement window that brings in friends and family in with you, including your daughter standing here, and the daughter knows that she can engage with mom in a very powerful way. So that's how that unit would get sold more effectively. So that's top line. Bottom line is all the benefits that really must go into the ROI of the organization when you're considering technology. So for instance, if menus are printed and put in common areas, or maybe in some cases certainly put under doors, or if surveys are really tough to do because it takes a lot of manpower to walk around with a clipboard and catch someone at the right time, and ask the same questions over and over again from many people in a very inefficient way. What if those can be delivered right on the TV? What if the dining menus could be right on the TV? What if broadcast messages could be right on the TV? What if the community calendar and all the work that the activity director does and the wellness director does, that's all in various calendars that can be presented and searched on right on the TV, and whoever wants anything that can be added to their own personal calendar, and they then get reminded with the TV. And the TV, in that case, if it's off or you don't respond, it follows with a phone call. So it's a very holistic view. But those are all part of the bottom line benefits, where efficiencies and staffing really kick in when the engagement is not just about social engagement, but about organizational engagement, community engagement, a tool that allows the community to run more effectively right down to the person in their room. Of course, I touched on the brand and the mission, so from that standpoint, it's a great time to be a leader of the pack when it comes to implementing technologies and leveraging that in your marketing, in your culture, in your brand as a caring organization that brings more to the table, and in the meantime, of course, has the efficiencies that we talked about. But certainly the quality of life is central to the resident. And finally, from a compliance standpoint, especially in areas like short-term rehab and some other examples, being able to have surveys, for instance, and being able to measure things in a way that's compliant and makes compliance easier, that even comes to the picture, depending on which segment of the market the organization is in. From a resident engagement standpoint, I covered the concept of you may be alone but never lonely. Of course, that's a huge deal for any resident because at the end of the day, oftentimes we do move in and we shut the door and we are left to our own devices, no matter how great the organization around us is. And that leads to, the better technology tools lead to improved quality of life and satisfaction, which of course then leads to more demand, leads to a better brand, et cetera. So it's a self-feeding system. And it's really important to emphasize that the right system addresses a continuity of care within the organization and a continuity of care within the individual and by the individual and for the individual. So I can't tell you how many examples we have, and I'm sure it's the case in general. We all know that somebody starts off with very little needs or certain needs, and then that quickly might change or slowly might change over time to very different needs or additional needs. And that's where the holistic nature and person-centric nature of the technology is so important, because you might go from social to more health. You might go from health to less health. You might go from health to social in the future, and all sorts of combinations in between. There's different sensors and different things. So somebody may be, become diabetic at that moment, then you can help manage that from a distance. But up to then, there was no need to have that as part of the overall consideration. And last but not least is the friends and family, the daughter and the son and the friend and the neighbor, and the peace of mind that they gain knowing that they have access to their loved one, and that at a reduced cost, really, and anguish, especially when it comes to the current stage of care versus the next stage of care, and particularly when technology helps with that in the home. That's a big deal, of course. So that helps from a marketing standpoint, but also very much from a practical standpoint. So this is sort of an all-in-one slide that puts all of that together. So this kind of gives you a lot of the various touch points that I shared up to now. So I won't go through each one here, but that's just more of a reference that you can have. But all the improvements from an investment standpoint, the family and community engagement all in one, all the services around that, and then it's really in the TV, so it's simple and familiar. As long as you can use the remote control, you're good to go, and it's nothing new to learn. That's really critical. So this is the slide I was mentioning. So if I were to review some of the concepts, the health devices here, they could be from various manufacturers. The home sensors, motion, open door, shut door, or let's say flood sensor, etc., could be obviously from different manufacturers here. And these typically don't meet anywhere. The one might be maybe an alarm type sensor configuration. The other one could be obviously, this one would be more of an alarm type. This one would be more of a health and a medical one. But the holistic person-centric view doesn't look at them separately. It gets the information from these organizations and ties it all together in certain requirements. There may be HIPAA or FDA Class 1 requirements, and others that's not needed. But either way, it's important to have it up front so that you don't just have a social model or you don't just have a medical model. Again, that's all there. And then you leverage, like I mentioned, the TV, but also what if the TV isn't there? I think it's really important not to have any kind of, again, encumbrances. So the basic platform to engage someone with is the telephone. So that's sort of the tie-in of all the different concepts, abstracting the hardware, so you have central management, central reporting, central alerting, and thresholds and rules, and the hardware can change and come and go, and you're not encumbered by it. And then on the other side, so this is also the care recipient or the resident, and this would be the professional and or the family caregiver. So the family caregiver in concept is the circle of care around them, and the professional could be the caregiver in the organization or the home health individual going to the home. And it's important to have both a mobile as well as a browser-based solution. In some cases also, when we talk about integrated, that also means and would stand to integrate with back-end data. So it's important to have that figured out and at least check-marked off that it's doable so that there's no duplication of information when there is already a repository over here for that information. So going back to the list, I did cover each one, and I wanted to review each one here at the end, so it's both at the beginning and the end, and we're right on time to be able to get to our Q&A. So I'll open it up. Jackie?
Yes. So thank you. This is really enlightening. The first thing that I think of, and I know some of our members are probably thinking likewise, is like when you are introduced to whether it's therapy-based technologies and medical devices like from Simple C, It's Never Too Late, Heart Legacy, and you differ with the platform-based technologies with Independa, how do I go to my CEO if I'm in an organization or a resident and tell me, what do I say to the folks that have to write the check to build a business case to advance technological opportunities for residents and staff? It seems like this integrated approach is kind of where everyone should be going.
No, that's a great question. Thank you, Jackie. So, yes, the answer is it's really important, and we talked about the culture, and that's the cultural step where we would work with that individual, and we have an ROI tool, so we would then engage with them to show, based on the numbers specific to them, what the benefits are. And so it's really important not to draw numbers, out of the sky or just from a care perspective. So we really look at it from a business perspective to be able to justify why there should be an investment. So it's not an either or. It's not just good for the business, but the residents have to deal with it barely. And it's not awesome for the residents, but of course it's expensive and not tenable for the organization. You have to have both. And the first step is really understanding what's there, what needs to be done, and also the cost of things, like how many calls do staff get every day to say, can you be a dear, just check in on mom, she didn't sound really well. Well, if I can check in on mom myself, right from my mobile phone, or if I can check in on mom from anywhere I'm sitting and have a visual interaction with her, noticing maybe she hasn't changed her clothes for 3 days straight. You know, what kind of value is that for me as a daughter versus I have to then commission somebody to go do that? I can't tell you how many times I've heard of, we all know this, where somebody calls staff goes out, either goes with a tablet to the person to do a Skype call, or they have to go to the computer room to sit there and learn something or do a Skype call. Well, all that is right in front of them on the TV that's not being leveraged. So I think it's really important to go do an ROI calculation before you go back to management. But then it becomes very, very compelling.
Absolutely.
Jackie, I see a question here from someone as well. So should I just read it, or were you going to read it?
Yes.
Okay. So it says, with these types of technologies, can the TV, set-top box, or software be leased, or must you purchase? Okay. And another great follow-up with that is, what if our policy is to have residents bring in their own TVs? So that's great. So first off, we certainly recommend that the technology should be leasable, because organizations should have a choice of whether it's an operating cost or a CapEx. So in many cases, if you're building at that point, then the CapEx may be more amenable, but other times it's a big dollar figure that could be spread across very comfortable operating costs on a monthly basis. So yes, it should be leased, whether it's a TV or a set-top box. I didn't mention a set-top box, by the way, and I will. If I go back to this picture, this TV is a generic TV. So on the one hand, there's a TV that could have all these services. And by the way, by the TV, it's important not to have it as an app on the TV, but to be fully embedded. So you don't have to learn anything new. There's no input to change, no channel to change to. On the other hand, to the second part of the question, what if residents bring in their own TVs? Then certainly there's a set-top box option that should be available, so anyone's TV can become the type of environment and engagement platform that I shared. So it's important to have choices always.
Awesome. So I'm really curious, what type of support do you need to offer? Either before, and what kind of support do you receive after implementation? So what I hear a lot are that it's great, things got set up, everything's running smooth, but I'm 3 months into implementation and there's a glitch in the system. How long am I waiting for someone to provide technical assistance, or for lack of a better way of saying this, I'm waiting for the next app update, which may be 3 weeks away. How does that all work?
Sure. So I think there's two components to that, and I can just speak to what I feel are best practices and how we do it at Independa, but I'll also be generic, so it would apply to, I think, any consideration. One is there's a financial component to support that, from our perspective, is really important to separate and understand when you're comparing costs, that you compare costs on a sort of apples-to-apple basis. So in our case, for instance, their support is built into a subscription cost, and the subscription cost covers, the support for the term of the agreement. In many cases, that's a separate cost that others might charge, quite a chunk of money for, and so that's important from an ROI perspective when we hear, as organizations, numbers to sort of normalize them to see if they're offering the same support, because that's critical, obviously. In terms of, again, what I think is best practices, for instance, speaking about Independa again, but I think this is something that should be done in general, is we have what we call a success ambassador. So the success ambassador shows up. Again, it's part of the cost of the system, and the cost obviously has to be very attractive, and the return is fantastic and all that. So these are not extra charges that we include. This is just part of the partnership that I was speaking to, where during implementation and for some period of time after, this individual on our dime, stays in a hotel, is local, and works shoulder to shoulder with the folks that they've been planning the implementation with, so that it goes smoothly. And that's really from a staffing standpoint and resident standpoint, even the friends and family of the individuals, there's a lot of additional help so that people come up to speed and are comfortable in the organization. So that sort of takes care of the first step, which is implementation. And then from there, to your question, or whoever asked the question, Jackie, regarding the ongoing support, that has to be, first off, highly vetted so that the right time zone and the right support levels are available, and also that to your point, it's not a long wait for things. But also, like in our case, and whenever we talk about the cloud, it's the implication is that it's always up to date. So you're not really at that point changing software updates. It's automatically updated all the time. You don't have to do anything. You don't have to go load it up and rerun something, and that's critical. So that makes everything sort of run smoothly.
Oh, fantastic. So I see there's another question in the chat room.
Yes. Is there a better, is this system better suited for my community, or can it go into an individual's home? Great question, and if I didn't emphasize this enough, I'll do that here. The person-centric approach is totally agnostic to where the person is, and that's the key. So the answer to that question is almost as simple as saying, does the person watch TV at home or in the community? And in the community, they may watch a lot less TV, but in both cases, the TV is there. So, and whether it's their own TV, like we just answered, or whether it comes in as part of the new construction and it's there from day one, that engagement window really changes the organization's ability to engage this individual. Now, if someone is in their home, so for instance, we have CCRC at home customers that really have engagement, enriched, fantastic engagement, but from a distance, so that it reduces actually their costs, but also increases their engagement and their visibility. And so that's one way to leverage it at the home. On the other hand, a lot of the benefits to the organization, such as maybe dining menus or community calendars and surveys and some other things that might be more prevalent, although surveys in the CCRC at home model would work just fine. That would give you additional benefits from the four walls sort of a CCRC or an IL or AL. So it's equally powerful regardless of where the individual is. It's just when we sit down on the ROI side, like we talked about, the ROI may be different in terms of, is it less trips but more engagement to the person, or is it less, time that the community calendar owner, the wellness director, is wasting every day knocking on doors and calling people to show up for the activities they've signed up for, amongst many, many other operational benefits.
So there's this other question here. Is the approach for new construction different than in an existing community?
Right. So the new construction approach would be different in the sense that when you're building a new facility, you can look at this appliance, like you might a refrigerator or an oven or a piece of furniture, and realize that it really changes the calculus on your operating costs and the brand and the top line growth and the bottom line benefits, like I shared, and include that TV as part of the amenity that someone gets to leverage where they live. And I don't say that just lightly, because a lot of the amenities obviously are outside of where they actually live. It's in the community, but it's not in my residence, where this is a really powerful, all-encompassing amenity that can be brought to the person right where they live after they've had dinner and they go to their room. So in that model, then the investment up front becomes part of an overall investment and a positioning of the organization that says we will be we will be really highlighting this, and we will be leveraging this as a business, but also as a marketing tool as we look to ramp up our occupancy. So that's the benefit of doing it early. On the other hand, of course, there's I don't know what the exact percentage is, but we have millions of individuals already inside residence and not in new construction. So in that model, that's where the set-top box would come in. Rather than wholesale changing everyone's TVs, you can put the set-top box behind the TV, and you get all the same benefits. I guess technically you could put a set-top box even in a new construction and have still people bring their own TVs, but there's actually a lot to be said about having a uniform, everything across the board that's helpful from an IT and from a organizational perspective as well.
I see. Okay, so it looks like we have time for one more question, and there's one in the chat room.
I see one. I provide home and community-based services. What's the pricing structure for our setting versus senior living? The pricing structure is really the same. Again, from our standpoint, and this, I believe, should be best practices, but I can't speak to anyone else's pricing, but I'll share ours, which is we charge on a think of it as per bed basis. It's really not bed. It's really per resident, let's say. And beyond that, there's no additional charges for that success ambassador. There's no additional charges for maintenance. But very importantly, there's no additional charges when additional sensors are being hung off that system for that individual. So you just pay for whatever the market price is for that hardware that needs to get added just for them. And also, you don't pay any different for the number of instances that either your professional caregiving staff access the caregiving tool, or however many ways and times the family members access the same tool. But in their case, obviously, they're just seeing mom. In the case of a professional caregiver, they're seeing everyone in the community as they need to. So the pricing model is very simple again. From a simplistic standpoint, it's super simple. It's per user per year, and it's a subscription basis. And typically everyone does some sort of lease on that, as well as if there's any hardware involved. So it's all sort of common sense stuff. We typically tie the software to the lease period as well, so it makes it very convenient.
So Keon, the way I understand it is so even if there's a couple in a particular apartment, it's still per person basis is how.
If there's a need for two individuals. So imagine if there's a couple, typically maybe one of them might need more care, and also maybe the friends and family can share pictures with them in a unified way, can share videos with them commonly, can share messages with them as though either one could see it, in which case you still need a license for one, not two.
I see. Well, this has all been very enlightening. I'm sure everyone's got a lot to think about after this conversation. If there are any parting words for you, Keon, I see that on your last slide you do have information. I just want to recite that. The phone number is 858-232-7211. Again, that's 858-232-7211 if you want to speak with Keon offline. And we are really grateful for your time. Also, just want to mention that you are a returning member of the association, and so we should be seeing you around.
Look forward to meeting everyone at the conference, and I'm going to finish with a slide, some of our partnerships in case you already have relationships with some of these folks. And it's been great, Jackie, and I enjoyed everyone's thoughts and comments and questions, and look forward to meeting you in person.
Thank you. Everyone, have a fantastic day. Bye for now.
Bye-bye.